Hey guys, Drifter here. My health is not good right now, and unfortunately it's worse than it was about this time a year ago. Over the last couple of months, my doctors have said I was dying, and then not dying, and then dying again, and then you're definitely not dying this time. I was given urgent referrals to oncology, hematology, and rheumatology. The problem being studied was complicated, but it was looking bad for me at the time, and everybody was trying to get me treatment as fast as possible. So, for the last 6 months, I've been spending 2 or 3 days a week in various oncology offices looking for rare cancers. And that has certainly been a wake up call. It's been an unpleasant emotional roller coaster in regards to my mortality, and the stress of this journey has certainly driven some of my more rash decisions this year. But the good news is that as of right now, and that can change, but as of today, I no longer appear to be dying. The majority of my labs and tests are normal or healthy, and a number of the ones that were more concerning have now returned to normal, but not for any clear reason. We're going to get into all the details of this very soon, but the main takeaway is that I'm not supposed to be dying anymore, or at least not any faster than the usual 1 day per day in which we're all experiencing. But one thing I do want to put in the beginning of this video before we get into the details is that while I appreciate any help that I can get and advice, some forms of help are counterproductive. For example, I don't need to be on a carnivore diet. I tried it. It didn't work. I don't need a fad diet that you've heard about on a podcast. I've tried a half dozen of them. They didn't work. I don't need to be doing intermittent fasting. I don't need toxin cleanses. I don't need skinny teas. I don't need essential oils. A chiropractor won't help me. A homeopath isn't going to help. Cold laser therapy isn't going to help. Acupuncture's not going to help. And I have no interest in converting to any major world religion in order to pursue magical solutions. Given that this is mostly an English-speaking audience, I'm mostly getting recommendations for accepting Jesus Christ as my personal savior so that he will then heal all of my ailments, but plenty of well-meaning people have recommended converting to Hinduism, Islam, Judaism, Scientology, and we even heard from a couple of pagan types here on the channel. I do understand that all of these types of advice are given from a place of compassion and well-meaning, but please hear me when I say that they are counterproductive and not received well at all. I'm in an extraordinary amount of pain right now, this very moment, even while recording this commentary, and my medical problems are equally complex. They're extraordinarily complex. So being told to pray more or do whatever nonsense they talked about on the Joe Rogan Experience only makes me feel worse emotionally. It's just kind of depressing. But I just had to get that out of the way. But let's move on to what is actually happening with my health. This summer, very shortly after the gun range video, I was feeling pretty good. I was feeling more active, I was feeling more confident, but unfortunately the back wasn't getting better, so I decided that I would go and pursue a spinal fusion surgery because I have pars defect, my bones are broken, and the spine slipped forward. I wanted to get a fusion. While it may be painful, it would eventually relieve my pain and restore some function in one of my legs. But in doing pre-surgical checks, it was discovered that I have severe osteoporosis in my spine, and I want to put the emphasis on the severity of how bad it is. The osteoporosis appears to be specifically in my spine and very minor to perhaps non-existent elsewhere in my body, but the spine is outrageously bad with a Z-score of negative 4.3. I'm sure that physical therapists and medical professionals know how bad that is, but for the rest of you, that is 4.3 times more likely than usual to have a fracture or an adverse surgical reaction. I'm 4 standard deviations away from normal, which is very bad. And while I'm not Mr. Glass from Unbreakable, we are kind of barely like in the same ballpark there. I do have to be careful with my spine. And unfortunately with bones that weak, that means there is no pain relieving spinal surgery for me. I get to drink a nice big tall glass of Deal With It for the immediate future, minus something that we're going to try that I'll talk about later in this video. And this started a journey to try to figure out why my bones are so weak, because I don't really have anything that would cause weak bones. Since then, it's been 6 months of nearly constant medical appointments where I averaged I don't know, probably about 3 medical appointments per week, with some weeks having 6 or more appointments, more MRIs than I can count, so many blood draws. Like underneath this shirt, my veins look like I'm an addict. I've just been giving blood so much for so many labs, I kind of don't even want to do them anymore. And despite 6 months of constant appointments, of constant specialists and scans and labs, we have no answers and only more questions about what's going wrong. Absolutely nothing has been able to explain the osteoporosis or my other musculoskeletal symptoms. Connective tissue symptoms are my #1 concern at the moment. My muscles themselves seem okay, but my ligaments and tendons seem much weaker than normal. They sprain very easily and heal very slowly. And by very easy spraining, I'm talking like opening a bag of chips, pouring milk, sitting with my legs crossed, walking down the stairs, but not up, brushing my teeth, or putting socks on can all cause sprains in various joints. I know that my muscle strength exceeds my joint strength, such that if I were to make a fist and make it really hard, I would probably strain something and pop something out of place. Or if I try to lift an object that weighs over about 20 pounds, I can do that just fine in terms of strength and muscle, but it sprains the wrist and the fingers that are lifting the object. It's like there's just no connective tissue holding them in place. And when I get one of these sprains, it can take weeks or months to heal, which is odd, and it has a tendency to fluctuate as well. There are times where I build more connective tissue strength and I'm doing better, and then it can quite rapidly get worse and then better again. And it's not particularly, what's the right word here, straightforward, organized, clear. There's no pattern to it. It just, as of right now, I haven't found the pattern. At least it just seems kind of random. So let's finally talk about what my new tests have revealed. And if you're a medical professional, this is going to be a wild section. If not, I'm going to highly encourage you to Google some topics and do some AI summaries or something, because I'm going to get a little bit complex pretty fast for the purpose of brevity. But here we go. My cytokine panel was elevated, specifically for tumor necrosis factor alpha and interleukin 10, which caused me to spend a lot of time at oncology centers looking for rare cancers, but none were found. My serum tryptase was elevated, which made doctors think that perhaps I had mastocytosis, because that could explain the spine, but I have no other symptoms of it. Blood cell counts are normal. My KIT, I don't have any KIT gene mutations, but I do have a gene mutation that gives me 1 extra tryptase chromosome, so I guess I make a bit more of it. But I've never had anaphylaxis or any allergic reactions. Histamine is normal. Allergy panels are normal. I don't seem to be having an allergy type issue, but it's still elevated. Weirdly, my lactate dehydrogenase, or LDH, was low, but maybe it's like borderline low. What's weird about this is typically when you have a bad infection or a cancer or a problem, it tends to get high. It can only be low in cases, to my understanding, of like a severe infection or perhaps a genetic disorder, but I don't appear to be having either of those at the moment. Kind of. The infection part is complicated because I got my IgG antibody subclasses tested, where we discovered that my IgG1 is low and IgG4 is significantly elevated. So my immunoglobulins are not in balance. They're odd. And what's weird is I don't appear to have IgG4 related disease or anything that really could suppress or change these ratios. So I don't know what's going on there. In terms of ratios, my albumin is consistently barely high, but my Ag ratio stays good. Serum ferritin in my blood is often very barely out of range in that it's too high. It's sometimes in range, sometimes just a little bit on the high side. I tested this a whole bunch of times recently and tested for a bunch of blood diseases, including multiple myeloma and hemochromatosis, all of which came up negative, and there's not a clear reason why I sometimes go hyperferritous. Hemocrit is also occasionally a little high. My cholesterol is 1% too high, but that's because I was encouraged to eat a lot of red fatty meat for the thiamine, because I was thiamine deficient, so that's purely a dietary issue. I've been eating a lot of grease and oil. Interestingly, the Epstein-Barr IgG antibodies are extremely high in the 400 to 500 range. I realize that means it's not an active infection, but the degree, it's like 100 or like 10 times over the range, which is crazy. I got my parathyroid hormones tested. Parathyroid hormone is often normal or low normal, like at the very bottom end of that little happy graph of what can be considered normal before it's too low. And this is very strange because people with normal or low normal parathyroid conditions typically have overly dense bones. When you have hyperthyroid, that's when you have thin bones. I have hypo, which should mean that my bones would be significantly stronger than usual, but instead I have the exact opposite problem. My EFGR, or kidney filtration rates, did a weird wobble this year. It went from 110 about 3 years ago, which was normal healthy, then down to 90, and then rapidly declined to the mid 60s over this past summer, and now has bounced back up to 90 again, or like 88, 89, which is pretty much normal, but there wasn't really a reason for that. Maybe I was just eating unhealthy. I do have a large parapelvic cyst on my left kidney that's about the size of the kidney itself, though it doesn't appear to be impacting kidney function. It seems to have grown around all of the blood vessels and urine collecting tissues. We're getting more MRIs of that soon to be sure, but as of right now, it doesn't appear to be bothering me. Imaging has revealed several cyst-like growths in between the bones of my forearm. I think that's radius and ulna, maybe, tibia and fibia, unsure. But in between the bones of my arm where they rotate, I have about 6 little cysts. They're often very painful and they get more sore the more I use my arm. But they're very small to the point where they may not be reasonable to remove without causing other tissue damages. My left arm also appears to have significantly less collagen than my right arm, as in almost all of my connective tissues in the left arm are very weak. At least that's what the occupational therapist says. Currently literally sitting on fully collapsed discs in L4 and L5 of my spine, leading to bone-on-bone grinding, along with severe spinal stenosis and a grade 1 spondylolisthesis with pars defect. That's a broken spine with no discs to cushion, just a whole world of pinched nerves. That's what I get to deal with every single day. And now this last one is going to be the most outrageous and unreasonable thing that I will say in this entire video, but I will swear to any deity that you want that this is absolutely true. Okay. I got an inch taller this year. I went from 6'1" to 6'2", even with the broken pars vertebra, even with the collapsed disc, even with the forward slipping spine. Every single one of these things, along with natural aging, is supposed to make me shorter with time. I literally got taller. I measured myself on the machines at 3 different doctor's offices and compared to past records just to make sure the machines weren't miscalibrated, or perhaps I didn't know my own height, but I consistently came back as 6'2", whereas in the past I was consistently 6'1". So as far as I can tell, I got taller, even though the disc height loss should make me shorter. Similarly, my shoes have been getting very slightly tighter, and I suspect that my feet are somehow getting longer. I kind of have skinny feet with high arches, so I don't think they're getting wider, but I do subjectively feel like they're getting longer. I haven't measured, I haven't gone to Foot Locker and done the thing. My new and old shoes both feel tighter than usual. I don't know, maybe I'm losing my mind. Maybe this is why people think I have mental health issues. It's been really weird, and it doesn't make a lot of sense, and I don't have any explanation for it. And one other thing I don't have explanation for if we're doing story time is I have this weird bodily quirk that thus far nobody has been able to explain. If I miss a meal by more than about an hour and a half to 2 hours, then I will get very sick very quickly. I want to emphasize how quickly this happens. I can go from being slightly peckish to starting to get delirious in about 30 minutes to an hour. We're skipping slightly hungry and moving straight into I haven't eaten in 3 days. My heart rate will elevate, albeit slightly. I'll start getting very cold, and then all of my joints will start hurting. Now, the scary thing is that if I allow this to happen by missing a meal or eating late, the joint pain can last for up to a week. The joint pain does not go away when I eat food, but the other symptoms will go away within about 2 hours of eating. I don't appear to have any diabetes. We'll be talking about that very soon. I don't seem to have any type of blood sugar or endocrine disorders that I'm aware of. I've taken my blood sugar during these symptomatic times, and it's always been perfectly normal, neither high nor low. It doesn't matter what kind of food I eat. I'm not even on a fixed time because I eat lunch at a different time every day, and I easily go 12 hours at night without eating, so it's not like a non-eating fasting issue. But just missing my lunch or dinner or pushing them back a little bit and letting myself get hungry will put me in the shadow realm, even if I had a big breakfast. It doesn't seem to matter if I exercise really hard or physically exert myself either, or at least those things don't change the urgency to eat or intensity of the symptoms. So I don't appear to be starving or low blood sugar or maybe wearing my body down through exercise. It's just that if I miss a meal, even by a little bit, I'll get very sick very quickly, and some of that sickness can last for up a week. Once again, I'm completely aware that this is unreasonable and medically unsound, and no medical professional has offered me an explanation for it. I can't Google something like this. It just seems to confuse the Google AI. It's just very weird, but that's what I'm dealing with. We're going to swap to the bed PC for the back half of this video because I'm getting a little bit tired of sitting, and this is overall more reflective of my reality anyway. I spend a lot of time in this bed PC with the monitor here, side monitor, mic, headset, mouse, keyboard, and everything you would need to get the majority of my work done, and I use text-to-speech at that. But let's get back onto the main topic. Those were all the things that were wrong with me. I do want to talk about some things that were abnormal but appear to have been remedied or at least understood, and a lot of you will have questions about the back, which is the main reason that I am here in this bed. So I have a grade 1 spondylolisthesis at L5-S1 in my spine, along with a pars defect and 2 fully collapsed discs that have bone-on-bone grinding, resulting in spinal stenosis. This one can't really be treated because the bones are so crispy, so I kind of just have to drink a nice big tall glass of deal with it for now. However, I might be able to get a spinal cord stimulator in the next couple of months, so hopefully the mechanical problems may persist, but there's a chance that the pain may not. I had idiopathic low testosterone that appeared to be completely solved by a 25 milligram daily dose of clomiphene citrate. I had idiopathic thiamine deficiency that resulted in dry beri that was remedied through vitamin supplementation and now appears to be fully stabilized. I had a Bartonella and babesia infection that showed on testing somewhat inconsistently and were difficult to confirm, but appeared to be fixed, and I have recovered significantly since the initial treatment round of antibiotics. Even if I'm down now, I'm still way better than when babesia and Bartonella were just going full blast. The only genetic condition I'm aware of having is cystinuria, which can cause an increase in kidney stones, but somehow I've only ever had one kidney stone in my life, and that's when I was just like living on Monster Energy. I haven't had a kidney stone in like 15 years. I do also have hereditary alpha tryptophanemia, which can elevate my tryptase levels, but it doesn't appear to be causing any other problems. And of note, mastocytosis has been fully ruled out because I don't have any KIT gene mutations or any symptoms or any other labs other than low bone density and barely high tryptase. So I've done a ton of medical stuff, and I want to tell you about the things that are normal, because I know a lot of you are very well-meaning and you want to give some advice. My complete blood count, perfectly normal, if not healthy, healthier than average for my age. White blood cells, red blood cells, platelets, everything seemed normal. I did a whole bunch of different thyroid panels, including some more complex ones. All of them were normal. I've done multiple parathyroid panels, and they were all normal, except every now and then the parathyroid hormone is on the very lower end of normal. If I were to drop another few points, I would probably be in the low range. I have done exhaustive autoimmune panels that tested ANA and CRP and like 40 different things on this giant chart, including a couple of rare diseases, and they all came back normal or negative. I did the autoimmune panel a couple of years ago, so maybe I should redo it and see if something has changed, but at the time it was all very, very normal. Genetic screening has thus far brought back nothing, or at least nothing that applies to any of these results. However, I'm redoing genetic screening this month and trying to get a whole genome sequence this time to see if there's any potential for anything that we've overlooked. I've had a number of very thorough endocrine and male hormone panel labs that have revealed absolutely nothing out of the ordinary. Testosterone, estrogen, prolactin, sex hormone, all that stuff is very normal. My allergy panels, including testing for gluten and celiac and all these kinds of things, all came back normal. I don't appear to be allergic to anything, and I don't seem to notice any food allergies if I'm eating. It doesn't seem to kind of really bother me. Kidney, liver, pancreas, and various blood sugar and diabetes panels were all very normal. I also had those things MRI'd. They don't appear to be enlarged or have any growths on them, minus the one kidney that has the cyst. I got multiple sclerosis panels and a couple of rare neurological disease panels that revealed nothing. Tests looking for multiple myeloma showed nothing. Various specific vitamin labs looking for deficiencies showed that I'm not deficient in anything, not even calcium or vitamin D, so that's not what's affecting my bones. I went to an eye doctor, a dermatologist, even a podiatrist for my feet because they were in so much pain. It was all normal. Nobody found anything. I did get a non-contrast MRI of my shoulder and of my hand itself, but not the forearm for like complicated reasons. But at least my hand and shoulder appear to be perfectly normal, even though I have some kind of limited function in these fingers. We don't know why that's happening. So I didn't get the full MRI because when you do an arm and hand and stuff, they like you to lay down on your belly and like stretch out Superman style, but with a broken spine, that's challenging to do, so I'm still looking for accommodations. I've done a variety of x-rays on my knees and elbows and wrists and stuff, some ultrasounds on some weird spots, and other than finding a few little cysts in my arm, all of those were very normal. There appear to be no structural problems with my bones or muscles or tendons or ligaments, even though they hurt quite fiercely. And all of my psychiatric evaluations were normal, except for one that we're going to talk about here in just a minute. But rest assured, I have received a very, very thorough psychiatric workup this year. After all of that, I'm basically in the same place that I started. The new problems are the same as the old problems. I have very weak joints that are prone to spraining, even when I'm exerting almost no strength. I can't even snap my fingers or like I'm singing along, or they'll just freaking sprain. I have extraordinary low back pain that's extra bad when sitting, so that's why I do so much from the bed and why I don't sit to stream and what makes it difficult to work and to travel. And it's crazy when you can't sit. I just want to emphasize this. I have less mobility than the average wheelchair user because they can sit. I cannot sit. I could not use a wheelchair if my life depended on it. I've got 15 to 20 minutes of sitting time before it gets too painful, and that pain can last for days or weeks if I don't get up and stretch. So that's extra bad. I have weakness and limited function in both hands. Left one is a lot worse than the right one, and this index finger doesn't like close. That's kind of about all it closes. It doesn't close all the way, which is a little bit weird. But it doesn't appear to be trigger finger. There's nothing wrong with it on imaging, or it's weird. So as you can imagine, all of this makes gaming, creating content, even just living your life quite difficult, that you could severely injure yourself for weeks or months doing insane activities like going to check the mail, putting on your shoes, flossing your teeth. You just don't know. There's all these little musculoskeletal problems that crop up and ruin my day, which has been very, very depressing, and it's been bad for my mental health, which is the perfect way to transition into the next section of this video, where I talk about the biggest disaster of them all, psychiatric evaluations. So firstly, I want to make it very clear to everybody here that I am extremely self-aware about how unusual my problems are, how improbable they are, how apparently poorly I present quite often. And I understand the claims I'm making are wild, and I empathize with those among you who are insistent that I'm a hypochondriac or have health anxiety or some mental disorder, because, I mean, if I were a doctor and treating a patient with my symptom set, that would be something I would gravitate toward because nothing else really explains it. And you have no idea how much I wish that were true, how much I wish I were just a hypochondriac, because then I could just take some Xanax or an SSRI or something, and I wouldn't feel these god-awful pains 24/7 in my joints. I'm also very aware that I have thought that I have figured out this problem several times in the past, only to be wrong. And it's happened so many times that I now appear to be waffling or perhaps just making up new problems. That perspective isn't lost on me, and unfortunately it isn't lost on a lot of medical professionals either. Oftentimes, despite having labs that verify some unusual problems, I still had to do psychiatric evaluations to prove that I was not faking these labs or photoshopping them, or that I was crazy. So we're going to talk about this year's psychiatric evaluations, but I did learn something bad about one of my previous psych evaluations from 4 years ago. The bad thing I learned is that a doctor did actually write me up as being a hypochondriac and submitted it to my insurance. So unbeknownst to me, I've been walking around trying to get treatment for various rare and debilitating diseases, only for medical professionals to, I assume, look at my insurance file, see hypochondriac, and just try to pass me on to somebody else because that's annoying to deal with. The technical diagnosis was somatic symptom disorder, which is kind of a nicer version of hypochondriac, but also the same thing, but also weirdly easier to diagnose and get. I could rant about this for a long time, but it's kind of a controversial part of the new DSM because anybody who's had health problems for more than 6 months that can't be solved and worries about them qualifies for somatic symptom disorder diagnoses, even if the physical ailments are real. So you could get like multiple sclerosis or multiple myeloma or leukemia, like a rare cancer, and be in pain for 6 months. And if you can't find out what's wrong and if it bothers you, you qualify for somatic symptom disorder. And unfortunately, most doctors know that that also includes hypochondriasis and things like that. So when they see it on the chart, it's like, okay, crazy person, bye-bye, get out of here. It's done a lot of damage to a lot of people, and I personally have a bone to pick with the DSM about how loose of a diagnosis it is. And I don't know how much this impacted my treatment or my believability, but I know that it didn't help. So let's finally talk about the 3 psych evals this year, or the several that I got, because there was 4. So my orthopedic surgeon ordered me to get a psychiatric evaluation before he would move forward with the spinal fusion surgery, and this was before we knew about the osteoporosis. My intake and eval at orthopedics and from him went sort of very poorly, with him telling me that I should not be in as much pain as I am, I should not be as weak as I claim to be, I should not need as many accessibility accommodations, I can sit longer, I can travel further, this is a mental block. I believe the doctor's exact words to me was, "Your mental game is weak," and requested a psych eval before I moved forward with the surgery. There were several other medical professionals in the same clinic that were equally unimpressed by my presentation and also required or requested or sort of agreed with him on psych evals, and other doctors in other professions also wanted similar things. And I gotta tell you, I think I was hurting so bad because they made me wait for like an hour. I was kind of laying down on the table instead of sitting in the chair, and the doctor kind of chastised me about not needing to do that and being a baby and this kind of stuff. And being told that my mental game was weak was ironically the exact thing to break my spirits. I didn't give up or quit, but I did get turbo pissed off and bent out of shape about it. A number of medical professionals also told me that, well, you did this to yourself because you don't work out and you don't exercise and you're not trying. And I would try over and over to say, look, I've got these 4 rounds of physical therapy. I exercise 3 days a week. Basically, they didn't believe me, so I started the series Bed to Brawn on YouTube and then continued it over to Twitch, where I promised to stream my exercises, light and physical therapy adjacent as they may be, for any and all to watch for about 3 months, because at the time it seemed like a reasonable way for me to prove that yes, I actually was exercising and I don't lay in this bed all day. And to be clear to all of you, I don't. I do real exercise 3 days a week, 1 cardio, 1 swimming, 1 set of weights. I stretch twice a day. I walk 2 or 3 miles a day. I get somewhere between 5 to maybe 7 or 8,000 steps on Fitbit every single day. My total standing time is probably about 6 to 8 hours, though broken into a great number of little chunks. Like, I am physically active and I am exercising and working hard, but nobody seems to believe it. And that level of butthurtedness appears to have the negativity in my emotion bled over into the Bed to Brawn streams, and I believe that I was being unnecessarily negative in a number of them. It kind of made my on-stream attitude not ideal. But back to the topic at hand about mental health. 3 of my psych evals are pretty normal. In the opinion of the medical professionals, it were that I did not have a psychiatric problem. There was a bit of a spectrum there, with one doctor believing that I had no problems, and 2 of them believing that I might have minor psychiatric problems like depression or health anxiety, but not to a point that required treatment, and also not out of proportion to the pretty extraordinary physical problems that I'm experiencing. So 3 of them recommended no treatment and to just continue to do therapy, try to be mindful of your mental health, because, the medical journey is going to be stressful. But that 4th psych eval, oh my God, what an absolute disaster. We're naming names on this one, okay? The fourth one was done at a location called Holliner Psychiatric Group here in Dallas, Texas. And I'm just going to straight up name names because this one went so wrong. It feels unethical for me to not discourage people from going there. Ironically, about 5 days ago, a subscriber who also lived in Texas reached out to me via email to talk about their own unusual health problems and their medical journey. This subscriber warned me not to ever go to Holliner Psychiatric Group because that facility tried to treat his diabetes with antidepressant medicine. But anyway, let's rewind about 5 months ago where I go to Holliner Psychiatric Group. I did what I thought was going to be a pretty standard psych eval where you go in, you talk to the physician's assistant for like 45 minutes, which is a nurse practitioner, and then you talk to the physician, which in my case was Dr. Holliner himself, for about 10 to 15 minutes. The physician's assistant for this place was absolutely savage and aggressive with me in a way that you just, God, I also swear to God and everything holy that she was straight up gaslighting me when I asked for clarification about what some of her words were. It was literally like the skit in Super Troopers where they try to meow a whole bunch of times during a traffic stop and then berate the person being stopped when they're confused about the meowing. I swear basically that same thing was happening. And I'd like to think I'm a pretty confident guy who can handle arguments and disagreements pretty well. But I got to tell you, this interview, I got put on my back foot so hard, so fast. I can't remember a time in the last decade that I had to backpedal so hard during really any human interaction. I got chastised for mansplaining about my corporation because they asked me where I work. And I said, I'm self-employed, and they got very kind of annoyed by that. And they're like, okay, well, who pays you? Like, how do you get your money? And I was like, oh, well, I'm self-employed. I do YouTube and influencing, and got very mad and snappy. What corporation pays your money? And I was like, well, the corporation is Drifter LLC. I'm a single member LLC. It all funnels in through there, from people that I consult with and stuff. Nurse just lays into me. It's like, I don't need you to mansplain to me about how pass-through corporations work. I've been a nurse for 20 years. I know about this. Let's just move on. And I'm like, okay. I got put on blast for filling out the paperwork wrong in regard to my family's mental health issues. So my family does have a lot of profound mental health issues. Unfortunately, a lot of them are not super high income and not of the culture where they go to doctors about it. So there's not a lot of official diagnoses in my family, despite some, we're talking like true, like break from reality, like psychotic breaks and hallucinations, and psychopathy runs in the family and other stuff like that. So I filled these things out accurately, and she just seemed very mad about it, eventually telling me we're going to get rid of that section because this has to have a medical diagnosis and not just your opinion. And I'm like, okay, that's fine. I got chastised for being at the meeting for the wrong reason because she had never seen a psych eval for a spinal fusion and had a lot of very aggressive questions about that. And the physician's assistant basically started diagnosing me mid-interview, saying that I'm obviously a hypochondriac and this is all fake, and that if you come in and get treatment with us, you'll be back on your feet in no time. So I asked her if she read any of the labs that I submitted beforehand, because I sent in my MRIs of the broken spine and the labs of the Bartonella, because I knew that these claims were incredulous. And the only answer I got when I asked that question is she gave me a very dirty look and a very stern no. And then I asked why. She very angrily told me that she doesn't have to look at labs in order to diagnose psychiatric conditions. And I'm like, okay, wow. Eventually I make it to the actual doctor visit. Dr. Holliner was really nice and seemed to disagree strongly with the physician's assistant about my diagnosis. He said that he said pretty much the same thing the other four psychiatrists did, which is, I'm not exhibiting any symptoms of a mental health condition. It's not affecting my life. I'm still employed. I'm maintaining my relationships. I'm still married. I'm still exercising on schedule, eating healthy, maintaining good hygiene. I'm going to therapy. I'm meditating. I don't appear to be anxious. I don't appear to be depressed. I'm not losing interest in life. I'm not hallucinating or anything. There doesn't appear to be any type of like disorder to treat here. And he told me basically to go on about my way. And thank God I got to talk to Dr. Holliner, but the rest of that group just needs to be thrown to the ninth level of the abyss. I am never going back to that facility again. And that's how the mental health evaluations went, which is the perfect time to transition into talking about how my actual mental health as self-reported is going through this process. And the answer is, it's going poorly. I think that despite a traumatic childhood and being in extraordinary pain in adulthood, that I've held my mind together pretty well throughout this unpleasant journey. However, I'm fairly confident that that has started to fade now as we are entering year 5 of suffering. I know for a fact that I'm more depressed than I was in the past, though I don't think it's particularly bad or limiting. The depression has a tendency to come and go, and if I get depressed, that typically lasts about 6 hours, and certainly less than a day, but it does creep up on me on occasion and just sort of drains my energy. Despite every doctor in the world doing their best to convince me that I have some form of anxiety, I don't believe that's true, though I do admit I have been feeling the emotion of anxiety a bit more recently. That's been very odd for me because for most of my life, I had the opposite problem of never feeling anxiety, even when I should, and it being one of the most rare emotions in my spectrum of emotions. So now, even feeling what is probably mild anxiety that doesn't even raise my heart rate once or twice a month feels really frequent. So I guess I do feel some anxiety, but I think it's still probably less than a normal person, especially if you consider all the nonsense I have to deal with here. But my frustrations and agitations with my situation and the world around me are increasing and mostly related to my physical limitations. My motivation to work and create is somewhat decreased. It's waning, but still present. I still have passion for my videos and my art and the things we do here on this channel, but it's not quite what it used to be. I also feel that I've been making some at least moderately rash decisions in my life, mostly regarding relationships and also money, which we'll talk about. Over the last 6 months, I've ended 3 multi-decade-long friendships. Each one, I believe, had to be ended for a different reason, though after you've done that enough times, it's concerning that the only thing in common is you. I've made some aggressive investment decisions that initially panned out very well and then didn't pan out so great at all in the long run. I bought a new car this year, I quit playing Call of Duty, I launched some new channels, and the way it feels to me is I've just been trying to make some significant changes in my life with the goal of improving things and improving accessibility. I want to play games I'm more happy with. I want to make content I like better. I'm restructuring my relationships. I got the new car because I can lay down on a mattress in the back and travel, and a whole bunch of stuff like that. I started or attempted to start 2 different businesses this past year, both of which completely failed for different reasons. I took some bad business pitches from friends. I gave some bad business pitches to friends. In some cases, I believe I have been a bad friend to a number of people. That's not a good feeling, but I think that's true. And for lack of a better way to describe it, it does feel like I'm squirming a bit. It feels like since I can't quite physically thrash around and exercise these frustrations because I'll hurt myself, that I might perhaps be running roughshod over decisions for the same type of emotional catharsis. I do have a tremendous amount of physical limitations that truly have begun to weigh on me and wear me down mentally. Just the list of things that I can't do and how long I haven't done it and how I've lost half a decade and some important decades of my life and missed opportunities and strained relationships and a lot of bad things like that. I don't think that I've lost my mind, but I do think that my overall mental health has taken an objective hit. It's not as robust as it used to be. I wish I had a more positive thing to say or that this was all fine, but I do think that you're watching me very slowly start to crumble here. All of this plays into mental health, but I'm more physically weak now than I was a year ago as well. Unfortunately, whatever my problem is appears to have hit another wave this past September, October. Things were getting better, and then in September and October, I kind of rapidly lost stability in both elbows and then both knees. One day things were fine. The next day my elbows hurt. The day after that my knees hurt and could bear almost no weight, and I was struggling to walk or hold things. I've made some improvements since then, but all of the joints in my body in general have just suddenly gotten weaker. That includes my hands, it includes my fingers, it includes the tarsals on my feet, and basically hips as well. Basically every joint. Fingers have some limited functionality now. And we don't talk about this often on the channel, but I'm not doing super well financially speaking. While the content is still flowing, views and ad rates are at an all-time 15-year low for me. I did good in investments and then bombed some this year, so I'm kind of negative money on that. And a lot of this probably has a lot to do with the sickness limiting my creation speed and my ability to experiment with alternative forms of content in order to save my hands from the pain of gaming. But I think that pushing out all this alternative content has also unfortunately pushed some people away. But for the first time in literally 2 decades, for the first time in 20 years, I am going to end the year with less money than when I started. And I'm going to be clear, I'm a long way from broke here. Savings are substantial and can last quite a while. But as a person who grew up with poverty trauma, it's very frightening to me to see the money be negative in any capacity. So as you've seen, I'm struggling to find my footing in a new genre of content and in my business and in my personal life. As far as content goes, I'm doing a lot more short form content, science content, games industry content, political content, IRL firearms quite a lot, food content, and even a media channel for media reviews, which has been quite fun. All of that has been challenging and fun because it's fun to learn about new things and experiment, but I need to start getting some wins here. I need to turn around this financial situation. I don't like seeing negative dollars every month, even with, a happy pile of savings. I could be doing better on that. So yeah, things are kind of bad right now, and I wish that they weren't, but I have to play the hand I've been dealt. I've got a pretty long list of medical appointments yet to come, and hopefully some of them can yield actionable results in the future. I would really like to know what is going wrong with my body so maybe I can do something about it. I got a couple of different MRIs and blood draws scheduled as well. There's an opportunity to get a spinal cord stimulator for pain relief, and I may also get these growths in my arm biopsied, so we'll see what that is. But all that has to come in the coming year, and right now it's a matter of choosing what is priority because I have to take breaks between these minor surgical procedures. So there's hope for some improvement, and like an absolute fool, I still haven't given up on the hoping that I'm somehow going to figure this all out and return to some version of normal. There's a tremendous amount of effort being put into trying to solve this problem so that I can reclaim some normalcy in my life. I'm really hoping the spinal cord stimulator at least allows me to stay upright for longer. Content is probably going to continue to flow as usual, with some weeks being busier or slower depending on how many doctor's appointments I have. That's the trick here on the channel. If you see me posting a lot of content, that means it's been like a week or two with no appointments. And when I'm just silent and there's nothing on the channel, that probably means it's been a very busy week for appointments. So if I'm super lucky, I might be able to fix one or two big things this year and maybe get back to streaming regularly. But otherwise, I'm just going to kind of wing it. And my promise to all of you is that there will not be a GoFundMe or a GiveSendGo or any type of grifting or begging unless I'm just turbo desperate. If you see that, you got to know that I'm about to bite the dust, guys, because I'm trying to avoid that so hard. So thank you to all of you who watched this video, who listened, who have been subscribed for many years and continue to support me. Thank you for the handful of you that still believe I'm not just experiencing a mental health breakdown, and I will try to update you again in the future when or if I find out what in the world is going wrong. So guys, that's all for this video. If you did like it, you could subscribe and ring the bell for more crazy updates, but otherwise we're mostly going back to gaming content. Drifter out.